So yes, it's International Nurses Day today, which is great. And yes, thank you all for the messages. I'm here to talk to you about the process of aging. Hi Nat. And what it is, what happens to our face and our bone structure and everything as we age and as we go through that process, and how it changes us, what we can do about it to slow things down a little bit and improve that appearance, and how I can help with that as well. So obviously, as usual, if you've got any questions, if there's anything you want to know, just pop it in the comments. Hopefully I'll catch it as I go through. If not, I will check them all towards the end or as I go through. So essentially, the aging process is quite a complex process in the face, and we talk about different layers of the face when we're talking about just about anything, particularly with aesthetic treatments. So there's sort of 5 main layers that we would discuss. So we've got our skin, then we've got superficial fat, so the fat pads that are closer to the surface. Hi Lizzie. And then we've got muscle throughout the skin, and then we've got the deep fat pads, so all of that fat that's much further down in the face, and then we've got bone underneath, essentially our skulls. So obviously, combined with all of that going on in there, loads and loads of ligaments, loads of vessels, and nerves as well, all at different layers and throughout the whole structure of our face, basically. So as we age, one of the first things that kind of like people will notice as they get older is, I will use my little friend. My son hates this, he finds it really creepy. Actually, it's the other one with all the veins in that he finds more creepy. However, so our skulls. So what tends to happen is, as we age, is actually we get what's called bony reabsorption. So our skulls don't stay as full. Hi Gemma. Our skulls don't stay as full and as healthy as they are when we're younger. And what happens, particularly around this section, so your cheekbone essentially starts to shrink, and it moves in and back. So your cheeks lessen, your bone reabsorbs there. It reabsorbs across your forehead as well, so that will start receding, and that will resorb backwards. So everything essentially goes in and back a bit. Similarly with your jaw and your orbit, so your eye sockets, they widen. So because all of that bone is reabsorbing over the years, we're losing what is essentially the structure and the scaffold that is holding everything up and in place when we're younger, which is why we look much more youthful, much more plump and healthy, and everything's in place because our skull is all in place, so the scaffolding is there. So when I talk to people about sorry, I've just seen Lizzie's comment come through. Oh God, kill me now. But when I talk to people about kind of reinforcing that scaffolding, when we're talking particularly around the mid-face, that's kind of what I mean. So what's happening is, because we're losing a lot of this, it's moved backwards, it's moved in, it's all shrunk a little bit. Our eyes, our orbits widen, so our eyes appear more sunken sometimes. And this is why, and this is where we can kind of try and rebuild some of that scaffolding to lift everything up a bit. Hi Alexis, you're right. So this is what's going on with our skulls. That's just one layer of the face that I've kind of mentioned out of the 5 that we're talking about. So that's one thing that's happening with our skulls as we age. And then we're thinking about the fat compartments. So as I mentioned, we've got the deep fat and we've got the superficial fat. And I think I've shown you this one before in, hi Alexis, in the lips video, I think. But so these are the kind of the different areas that we've got fat pads, and they're all different compartments. So you haven't just got one big layer of fat. Hi Amber. You haven't got one big layer of fat going on. You've got all these different compartments. So the fat that's holding us, holding up, you know, the structure around our eyes, as I've just mentioned, with the bony reabsorption of the skull and your orbits widening, the fat is also then moving, because actually the structure of the bone isn't there anymore to support all of that. But one of the main ones, which is what I talk to a lot of people about, is the mid-face fat. So we've got these compartments in different layers of the skin. So some of these, so here, for example, is more superficial than it is here. So you're talking sort of this area is relatively superficial, gets deeper as we've got the fat sort of more mid-face. So what happens with these is your fat pads shrink as we get older, and as they shrink, they drop. So that's why we're getting hollowing around our cheeks. That's why we're getting more lines around here. So as you can imagine, you know, if these fat pads here are shrinking and lowering, particularly this one, so this one here on the picture, can actually, this one in fact can actually get bigger, unfortunately, whilst this one's getting smaller and dropping, and then it's pushing down. So everything, it loosens, it lowers, and that's where you're getting your creases in your folds. Hi Michelle. So and this is where we're then noticing the lines here, the lines here, the jowly bits around here. As these start loosening, it's because everything has gone down a little bit. So hopefully, I know it's a very, very basic kind of explanation for it all, but this is where we're seeing our eye bags and our lines lower down in the face. And actually, I talk to people then about refilling that that scaffolding, that structure back into the face, but to lift things back up again and give that support back to everything else that is sitting on top. Which is kind of the idea about it. But also, I mentioned about ligaments as well. And so when we're thinking about our under eye area, let's see if I'm a bit backwards in the screen, but when we're thinking about our under eye area and the appearance of bags under our eyes or hollowing areas under our eyes, and again, sometimes it's actually appropriate to look at the mid-face and look at what's happened in the cheeks, in the main scaffolding part of our faces, because we've got essentially two what's called true ligaments in our face. So our ligaments are obviously spread all around and in all different layers, but there are two ligaments across the face on either side that actually are called true ligaments because they run bone to skin. So they complete all the way through, and that is this one here and this one here. So if you can imagine, as this lowers, it's putting pressure on these ligaments here and across here, and that's why we're noticing these lines more often. And so actually it's sometimes not even the lessening of the fat and the volume that you've got under your eye, it's the pull that you're getting on here, because it's accentuating these ligaments that, like I say, run true, so they are surface to bone. And the only two that we've got either side in our faces, the others are sort of sprinkled throughout the different layers. But that's where some of that kind of really noticeable area is. And so again, we need to be thinking about our mid-face. So that's a little bit. Have anyone got any questions so far? Please drop them in the comments if you have, if I'm not explaining things carefully. Obviously, I'm trying to explain it so that it can be understood. but if I'm not making much sense, please let me know. So then, so we've talked about the bone, we've talked about the fat. So that's obviously the fat in the deep and the superficial. And then we've got our skin as well on the surface. Oh good, it's interesting, thank you. So then we need to think about the skin on the surface as well. And again, you know, our skin, largest organ of the body, has loads of functions. Hi Nicola. So actually there's lots of things that our skin is responsible for, from just simply keeping everything in place and where it should be. It protects us, it guards us against infection, it regulates our temperature. So it's responsible for an awful lot of things. Hi Angie. And it is also the organ of our body that is taking the most beating, essentially, from the environment, from the way we treat it, from the way... What age do you start to notice the pulling down in the face? It can be any age, really, Michelle. People do age at different rates, and there are other things that are going to kind of contribute to that, from lifestyle. We've got our intrinsic factors and our extrinsic factors. So we've got intrinsically our genetics, our DNA, basically. So you can kind of look at your family line and think, okay, well, you know, he or she looks pretty good for their age, quite good genes going on there. Children, yes Amber, children are going to make you appear more aged because it's a stressful lifestyle. And this is it is a stressful lifestyle, you know, that so many of us lead. But we've got the extrinsic factors as well. So, you know, sun damage, smoking, drinking, diet, exercise, the free radical stuff, so pollution in the air, all of that is affecting the rate at which we age. And I mean, we're all going to age. There is no getting around that. So even, you know, even if you were fully protected from just about every stressor and every bad thing, never drank, never smoked, never sunbathed, all of that sort of stuff, you're still going to age, because that's genetically, that is just what happens. But what we can do is so we can't change the intrinsic stuff, but what we can do is change the extrinsic stuff and our exposure to some of that to try and improve our appearance of aging. So yeah, that was a really long answer to a question. Basically, yeah, it's going to be at any age, and you're going to notice the signs at different stages in your life as well. So yeah, so thinking back to the skin, as I mentioned, it's responsible for loads and loads of things, and it is taking a great deal of beating from you know, from the environment and from what we do day to day. Now, when we're younger, our skin is fully working and it's behaving effectively, it's doing what we want it to do. So new skin is growing quite rapidly. Our old skin can shed off quite easily, quite quickly, and actually, in babies and children, that's usually sort of a 2-week turnover. Once we reach our teenage years, you're actually looking at a normal cell turnover of about 28 days. By the time we hit our 50s, we could actually be looking at something more like 84 days, I think, for your skin to go through an entire process of regenerating, growing new skin cells, maturing skin cells as they reach the surface, and then sloughing off afterwards. So you could be looking at, you know, in excess of 3 months before your skin has gone full circle, and you're actually seeing some of those new cells. So what's happening in our skin, not only have we lost all of the stuff underneath, but what we're seeing on our skin is essentially old, dead, crusty skin cells stuck to the surface of our skin, which is what's making us look tired, and it's making us look dull, and it's giving us an uneven and unusual complexion. And you know, and so we're losing a lot of that. So that's just the cell turnover of the skin. What is also in our skin as well, in the deeper layers. So I've told you about the 5 layers of the face, but actually just in layer 1, in terms of the skin, there's more layers there as well. And so in the dermal layer, so the deeper layer of the skin, is where our collagen is produced and our elastin is produced, and they are produced by something called fibroblasts. And that, just like everything else as we age, they get sluggish, so they're not firing properly and working as quickly as we'd like, so they're not producing the collagen and the elastin. And it's the collagen and elastin that everybody they've heard of these terms, so they know that that's a good thing to have, because we've got lots of collagen when we're young, and that is essentially the protein that is responsible for our skin being nice and springy and plump, so that when we stretch an area, it bounces back really nicely, and it keeps its shape and its hold and all the rest of it. So as that starts reducing, and that's not firing and producing as much as we want it to when we age, so we're also losing that collagen underneath in the dermal layer of our skin. So we're losing a lot of that as well, and that's where we're then seeing, because when we're expressing ourselves, when we're making facial expressions and we're talking and we're sleeping and we're doing all sorts, that we are then, our skin's not bouncing back the way it used to, and that's where we're seeing the development of the lines and the wrinkles that are coming through. And over time, those repetitive movements means that the skin then isn't healing itself, it's not bouncing back, it's not healing itself, and so we end up with those lines and wrinkles that kind of don't go away again, and they end up being there to stay statically when we're not actually expressing ourselves. So that is a very quick whistle-stop tour to kind of what is happening to us as we age. Now, as I mentioned about the external, extrinsic and intrinsic factors that affect our aging, and I do talk to people quite a lot about the sun damage that we have, hugely responsible for about 90% of our aging, because in the sun every day, or just day-to-day life, we've got the UV rays. So even if you're not somebody who's using sunbeds on a regular basis, just going out and about, just living your normal life, you are being, your skin is being damaged long term by UV sunlight. And there's two major rays. There's actually three, but there's two major rays that we worry about. So there's UVA, UVB, and there is UVC as well, but UVC doesn't tend to actually penetrate through the atmosphere, so we don't worry about that one. So actually we worry about UVA and UVB. Now UVB is a short ray essentially, and so that is what is associated with us burning, so sunburn, and it can be quite heavily associated with things like skin cancers. But that's what burns us essentially. And then we've got the UVA for UV aging. So these are longer rays that actually penetrate through windows. They penetrate through cloud. So even on a cloudy day, those UVA rays are reaching us, and they are reaching our skin to damage it. And actually they penetrate much further into the dermal layer of your skin. So it's the UVAs that are then coming through and beating down all of those fibroblasts, that collagen, that elastin, and causing that damage underneath, in the real depths of your skin, in your dermal layer, that's then causing a lot of those signs of aging. So that's why we say UVA for aging, UVB for burning. and that's kind of how we differentiate the two. So when we talk about protecting ourselves from that, we're actually thinking what we need to do is you need a broad spectrum sunscreen, so that would then protect you against UVA and UVB sun damage. So have we got any questions? And I will start talking to you about what we do about it all. Answered that. Okay, lovely. So I did write some notes. I'm likely to forget. I do keep getting distracted doing these, and I talk about all sorts. So, like I said, don't forget there's things that we can't control. So actually we can't control the fact that we're going to lose our scaffolding down on our bone. So what I've explained is how the aging process affects us right the way from our skull and the bony reabsorption, the fat reduction and movement, and then the skin damage in itself as well. So I've mentioned already about protecting us and our skin from sun damage with a broad spectrum SPF. Should be no less than 30. So, you know, the usual is anywhere 30 to 50. And also it needs to be a physical sunscreen as well. So again, there are differences between, you hear about chemical sunscreens and physical sunscreens. Chemical ones are the ones where, you know, when you read the label and they say apply 30 minutes before going in the sun, that's because chemical sunscreens sink down into your skin and then kind of protect it in that sense, but they also do, as the name suggests, contain all variants of chemicals and things that it's suggested that over time is not good for our bodies, our systems internally, and can cause, you know, their own problems. But a physical sunscreen is different in the sense that you apply it to the surface of the skin, and what it actually does is it bounces all of the rays, bounce straight back off your skin. So actually it can't penetrate your skin to begin with. The UVA rays can't penetrate your skin to start. So that is why it needs to be a good factor, a physical and a broad spectrum sunscreen. So that is the number one thing you can do to protect yourself from the aging, because again, there's essentially less point in trying various treatments and other active ingredients to try and improve your skin and your structure and everything if you're not going to prevent the damage that is being caused. If you're going to let that damage carry on, you're not going to achieve the result that you really want. The other thing we need to be doing when it comes to our skin is exfoliation as well. So as I mentioned, by the time we reach our 50s, our cell turnover could be looking at around 84 days. So that's quite a long time. We need to speed that up. We need to get our skin moving. Hi Jane. We need to get our skin moving and get it working the way that it should be again. And so the best way we can do that, really simply as well, is by exfoliating it properly and stimulating our skin and our fibroblasts to keep working, keep creating all of that new stuff under the surface, the collagen and the elastin and the new healthy skin cells. So we need to be able to effectively slough off all of the stuff on the top. And this is why you can use good daily exfoliators to do that. I would recommend avoiding those really harsh scrubs because they simply kind of aggravate the skin and irritate it. So they're not the best thing for exfoliating. A lot of I think in terms of the products that I use, we've only got really one that contains any kind of like scrub type thing, but it is it's a gentle scrub. The bead's completely biodegradable, so it doesn't scratch your skin, it doesn't irritate it, and it doesn't affect the environment either. However, acids are brilliant for exfoliating. And I know acids sounds a little bit scary, but actually what they do is they sink right into the skin. They do their work at loosening things and separating all of the dead skin cells from your younger skin cells underneath, so that they can actually get off. So these are what are essentially alpha hydroxy acids, which are things like lactic acid and glycolic acid, if you've heard of those things before, and retinols, so a retinol A, a vitamin A is a retinol derivative, or the other way around, should I say. So yeah, all of these things end up hydrating the skin, because you're actually allowing that dead skin cells on the surface to get off and out of the way, which means anything that you are using on your skin after that is actually getting towards your skin, your healthy skin, to do what it's supposed to do. So that's exfoliation. We also want to try and do what we can to stimulate our collagen production. So we want to boost those fibroblasts into working for us again, to boost that collagen. And there are various products out there that can really help. And what you want is something that stimulates type 1 collagen, and preferably also type 3 if you can get it. So type 1 collagen is the collagen responsible for our hair, skin and nails. Okay, so if you can incorporate that into either your internal routine or your skincare routine, type 1 collagen is what you're looking for. It is said that in certain types of collagen, you can, some topical products can help stimulate their fibroblasts. Some internal collagen products can mimic your own body's natural DNA, in terms of then encouraging it to reproduce its own. So that's how, kind of like very briefly, how some of these things are working. And you'll notice the difference then, like I say, in your hair, skin and nails with type 1 collagen. So that's that. Then we can think as well about our muscles. So this is where I know a lot of you already come and see me for your Botox or botulinum toxin treatments. So I know lots of you already come to see me for that. It's not something that I kind of freely talk about now on my more public social media pages, because there is very specific guidelines about not being able to talk about it, because it is a prescription only medication. It would be sensible to mention it as I'm going back down through all the layers of the skin or the face. So muscles, like I say, if we are repetitively moving our muscles in our face, and our skin is compromised, should I say, then we're getting that repetitive movement. Those lines are redeveloping and they're not bouncing back the way we want them to. So by essentially blocking that signal to the muscle that says move, we're going to slow that ability down for your muscles to keep on moving that surface skin and creating those wrinkles. So it can be really effective in that sense, to like I say, block the muscles, work on that, and allow our skin that chance to kind of rebuild a little bit and help it out. And sometimes in some people it can just stop us looking really angry even when we're not. It can give a really natural effect. But like I say, it's one of those things that actually should really be done in combination with good skincare as well, because we can block those muscles all we like. If you haven't got a good quality skin on the surface, then those signs are still going to be there, that those aging lines are still going to be there, because we're not repairing our skin on top. And then as we go further deeper, we start thinking about that scaffolding that we've lost. So right from the beginning, as I was saying, oh, there's my notes. yeah, so as I was saying right from the beginning, we've lost all this scaffolding, so our orbits have widened. We can't replace, you know, your eye socket, essentially. We can't make that go smaller again. But what we can do is build upon these sorts of areas here. So there is actually fillers you can have all around the temple. I don't do those, but you can have fillers across the temple. You can have them across the cheeks, the chin, and rebuild that structure back in. So what we do is using quite a secure, highly cross-linked is what it's called. That's like scientifically, they cross-link the hyaluronic acid to make it more stable and more long-lasting. Place it right down here onto the bone. So we, you know, with needles or cannulas, we go right through the skin, place filler on top of the bone to start lifting that area back up. And so even, you know, even as I'm talking, I can see I've got my lines here. I can see them, and I can see, you know, ever so slightly things starting to kind of work. And so if I lift, give myself a little bit of a lift, not that I do this myself, to myself, but you know, as if I lift some of that back up again and start rebuilding that structure, these areas start softening as well. So really, really delicately can be done. Doesn't look fake or kind of overdone, because all we're doing is actually replacing what we've lost and rebuilding, giving ourselves that scaffolding back, which means our skin has got more to kind of support and smooth around, and again it can then soften out those lines and those wrinkles as we get older as well.